Before the disease, Luna was a perfectly normal child, developing without any issues, a very smiley, cheerful, loving child. The disease hit literally overnight. She went to bed healthy and woke up unrecognizable. She turned from the loving, sweet child to a very anxious, withdrawn, highly irritable. She had extreme mood swings, which we've never seen before. One of the strongest symptoms in the beginning was extreme heart palpitations, chest pain. Her body started stiffening. Sometimes she tried to walk, but she was losing her balance, and then she would walk again normally. She started having sensory hypersensitivity, which she never had before. One day she started having some visual disturbances, and that's when we really freaked out, because we understood then that she's got some serious issue in her brain. Our first suspicion was some kind of tumor or epilepsy, because often these attacks were very sudden. We were completely confused and worried, but also the moments, days or hours where she was kind of normal made us think that it can't be anything serious, because why would she then suddenly be normal again? She often had severe rage attacks for no reason. She turned this rage against her twin brother. She started attacking him in a very aggressive way, as if she really, really deeply tried to hurt him. She would demolish the house, and for sure she tried to hurt me, and she tried to hurt herself too. During one of these attacks, we found her in a dark room, sitting in the corner. She was not responding. It felt as if she was completely gone. And we rushed to emergency. They did CT scan of the brain, and then we were under observation for 11 days. And tests didn't give us any answers. Before the onset of our child's symptoms, she had strep, so we just thought it's just a regular infection like any other. We had no idea what happened with her personality change had anything to do with this. Then a flu hit us, and she got dramatically worse. So clearly, whenever she was having some infection, she would develop new symptoms afterwards. We went to neurologists, psychiatrists, psychologists, laryngologists, immunologists. We were just sent from one doctor to another. There was a doctor, and lucky enough, she was in our town, who, as one of a few doctors in Poland, knew strep-induced psychiatric symptoms in kids. She gave us the initial diagnosis. We have just finished the first round of IVIG treatment for Luna. We were very hopeful seeing these really amazing improvements she's had in the last weeks. She's way better now. Brain Inflammation Collaborative seems to be what we parents and children have needed desperately for so long. Normally, a doctor probably sees a few of such patients in their career, but this is not enough for them to make any conclusions. Finding patients and collecting their data is such a long process, and it's one of the obstacles of why the treatments are not progressing very much. If researchers all around the world could access this data, this would be a breakthrough for all the children.